Now I welcome Dr. Sudheesh sir. He is a professor of anesthesiology, Bangalore Medical College and Research Institute, and he has published 35 publications and he has presented 65 papers, and he is the treasurer ISA Bangalore Metro Branch, and he is the immediate past editor Karnataka Anesthesia Journal, and he has been awarded ISA President Appreciation Award 2020 and 21. And his areas of interest are in regional anesthesia, research methodology, and difficult airway and critical care. We welcome Mr. Over to you.
Good afternoon. Thank you, respected chairpersons, for your kind introduction. And at the outset, I would like to thank Edward sir and ALM sir and the entire team of Kanyakumari ISA as well as Kanyakumari Government Medical College Anesthesia Department for this wonderful opportunity. So all this time we were listening to a totally different topic where these are with regards to patient management. Now this is one topic which is an essential part of your MD 3 years MD program, where you are expected to submit a thesis and you are expected to do a dissertation and submit a thesis. And as per the new NMC guidelines, thesis does carry 20 marks in your practical exams, and it has to be evaluated by the external examiner, and you might be asked questions regarding your thesis during your practical examination. So therefore all these things makes it much more adds more emphasis on this. So I wish to bring greetings from my institute. So dissertation, what is dissertation? Basically it's a document which formulates the result of whatever research you carried out in the year in your period of MD training, and under the guidance of a mentor or a guide, and then you present and publish it in a literature. So this is a dissertation, and basically it's mainly to educate the students regarding the basics of research methodology, and also to promote the knowledge of scientific writing, and also to encourage critical thinking. So the guide plays a predominant role here because he actually mentors his proteges through the process of education of the research methodology and conducting the research. And sometimes we could also have a co-guide, especially if it demands that you require an additional person from another department also to be a part of your dissertation. So what are the steps? Basically, you first and foremost is identifying a particular pertinent as well as a proper research question which is important. That forms a main cornerstone, and then you formulate the type of study and the study design based on the research question, and you select the proper population which is involved for the study, and then plan a proper methodology, and then collect the data and collect those research data accurately, analyze them statistically, and finally conclude it by distilling the outcome and put it in the form of a dissertation by writing that, and last but not the least, publish it in a well-known peer-reviewed journal to increase your visibility. So now coming to the different types of trials, we have two different types of trials basically. One is the intervention trials, where you intervene by either by avoiding a particular thing or introducing a particular thing to prevent a disease or to treat a disease. On the other hand, we have observational studies where you don't actively involve by doing anything, you don't do any intervention, you just observe the patients undergoing the procedure and see what are the outcomes that are happening in them. So one of the most important things in your dissertation is generation of a good research question. Now what is a good research question? It's one of the most cornerstone of a good research, and basically it has to involve, it has to satisfy, it should contain some of the things which are mandatory, that is explained by this pie chart, and also it should satisfy certain criteria which is defined by final criteria. Now how do you mean by that? What do you mean by pie chart? Means whenever you generate a research question, that should contain all the elements, that is it should contain the population in whom you are going to conduct the research, and then whom you are going to intervene, what is your intervention, and what will be the comparator, that is intervention test and control, and then what is the outcome you are actually looking for, and finally how long you are going to conduct the study. This is the pie chart. Final means again the whatever research question you generate, it is to be feasible in your place of work, and it should be interesting to you, not for us, it should be interesting to the whole person who is going to read that, and then it should be novel. Okay, so just telling that adding 5 microns instead of adding 5 micrograms, you add 10 microns, that is not novelty. Which is not found, which is not routinely found in your existing literature, that you try to find out in your research, that is called novelty. And then it should be ethical, that is one of the most important things, and it should be relevant to the present day practice. So let us, but one thing you need to understand is, it's not always necessary that research question be the title of your dissertation. It can or it cannot be the title. Your title can always be changed later once you complete the study. But research question has to be decided before you conduct or before you start the research. So just let us examine, this is one research question. Does intrathecal ropivacaine with morphine provide faster mobilization compared to ropivacaine alone in patients undergoing knee replacement surgeries? Okay. Now let us examine this research question and see whether it satisfies all the PICOT criteria. Now what is the population here? Which the persons who are undergoing the study. It is the patients who are undergoing knee replacement. Okay. So that counts the population. Now next is I, that is intervention. So what is the intervention? Is it spinal anesthesia? No, it is not spinal here. Here, because we are using two drugs. The administration of drugs is the intervention. So therefore, administration of ropivacaine and morphine intrathecally becomes the intervention. Now what is the comparator? Obviously, ropivacaine alone will be the comparator. And what is the outcome you are looking for? Faster mobilization. Faster mobilization means, so it can be represented in multiple ways, whether recovery of motor blockade or time to start moving or conduct of physiotherapy, time to start physiotherapy, all those things contribute to faster mobilization. And time, of course, again, time is not always necessary to be mentioned in a research question, only when it is feasible. Next comes review of literature. Review of literature is another one more important thing in your conduct of research, because it helps not only to generate a research question, but also it will help you to understand what is the scientific background of your study and to understand what is the gap in literature, so that you can generate a good research question and then to substantiate your research question and its findings. Many times whatever findings you found has to have a proper scientific explanation, or else it becomes invalid, isn't it? So research, review of literature is very important for that, and also to establish ethical and the knowledge needs of the research. So basically, how do you start? You just first start with the bibliography of textbook. That is, if you look for a particular topic in which you want to do a research, then go to the particular chapter of a standard textbook. Let us say you want to do a study on spinal anesthesia, go and open the Miller's textbook, go to the spinal anesthesia chapter, go through the literature, list of references published in that chapter at the end of the chapter. And from there on, you can start reference chasing and see the journals. From there on, you can go on searching for articles related to it. Or else, you can also use various search engines such as PubMed, then Google Scholar, or PubMed, Scopus, Medline. All these things are the reference engines where you can get adequate literature to support your study. Next comes the aims and objectives. What do you mean by aim? It is a goal to be achieved by conducting the research. So it is the aim. For example, you are trying to assess the study of efficacy of a drug or something like that. So that is the aim. Whereas objective are the specific statements of measurable outcomes. To achieve one particular aim. Let us say if you are doing a study to achieve the efficacy. Now how do you achieve that aim? Is by measuring. So for example, efficacy of an analgesic drug might be the potency of analgesia or the duration of analgesia. So you can use specific measurable words to attain that particular aim. They are known as objectives. It's imperative that objectives should always be, they can be always classified as primary objective and secondary objective, and usually it's always preferable to have one primary objective, because your entire study and research question is dependent on the primary objective, and your sample size estimation, everything will be dependent upon the primary objective. Objectives needs to be specific, smart, that is specific, it should be easily measurable, and it should be achievable, and it should be relevant to the topic what you are doing, and finally it should be able to complete within the time or within the limited period what you are thinking of. Now coming to the study methods, which is one of the most important things. So
Study methods. So when you describe about your study method is nothing but how you are going to conduct the study. So it predominantly involves explaining or determining certain things. That is, first of all, you should describe where you are conducting the study and how many subjects, which kind of population you are going to involve, and then what is the duration of your study. And then next is the study design. Again, I'll be elaborating on these things. So study design, and then how many patients, how do you recruit the study population into your study, and how many of them you recruit, and then based on once you recruit them, how do you include and how do you exclude, and ensure that you got the right set of patients, and then randomize them into groups so that you don't allow the bias to creep into your study, and then blinding and allocation concealment to ensure that all the patients have a chance of either getting test or conservative or a control treatment. And then detailed description of how we are going to do the procedure, and then proper description of study tools. For example, you are doing a study on BP. You should clearly describe what kind of BP apparatus you are using, what kind of equipment you are using, and when you are going to measure the BP at what time intervals. All those things has to be clearly mentioned. And suppose when you use certain parameters such as hypotension, bradycardia, etc., it has to be clearly defined. So let us say if you are talking about a study on duration of analgesia, you should clearly decide like what do you mean by duration of analgesia. For example, from the time of administration of the drug to the point when the patient starts asking for rescue analgesia. That can be described as a duration. So we should have a clear-cut definition of all the parameters we are going to study. So let us go one by one. So study subject is basically about location of study, type of students, patients to be selected, and also duration of recruitment. Now study design, basically it defines how you are conducting this. So you can have cohort study, you can do a case control, it can be a primary research design, or it can be cross-sectional observation. That is, at one point of time, you recruit all the patients and observe what is the changes in that particular point of time. That can be cross-sectional, or randomized control trial is one of the most common things what is done in our routine practice. And this is the one interventionist kind of a study what we follow routinely in our anesthesia practice. So next is study sample. Once we decide what is the study design, then we can, so now one more thing what I need to emphasize is your study design is based on your research question. So therefore, once you decide a research question, you can decide upon what study design you can choose. Let us say, for example, if you want to do a study on duration, comparison of analgesic potency of two drugs A and D. You can do a randomized control trial where you can give drug A to one group and drug B to other group and compare. That is one of the easiest methods. Suppose there are some ethical concerns. You can also go for alternative techniques like cohort study or a cross-sectional observational study where you just go on observing all the patients who take these two kinds of different types of drugs and compare. So that is also one method. Or you can do a cohort study where you see how many of them are taking these two types of analgesic drugs and follow them up and find out what happens to them. So likewise, your study design keeps changing depending upon the type of study you want to do. So you can decide upon that beforehand. Next comes a study sample where the number of patients you have to select. So basically study sample is nothing but a set of patients from the population, target population whom you select for a particular study. So basically they are the ones who are going to be benefited by this particular research. So therefore sample is nothing but a representative subset of a population like what we see here. So once you know what is study sample, now there are two questions which we need to answer. One is how to select them. You cannot select them just according to your whims and fancies. There has to be a particular protocol as to how you select them. And second question is how many. So how to select a study population and how many subjects to be selected are the two questions to be answered. So if you want to know how to select a study population, you follow something called sampling method. Whereas to know how many subjects you have to select, you calculate the sample size. You calculate the sample size and recruit according to that. So what do you mean by sampling method? So basically it's nothing but the way you pick the person for your study from the population. So we have two different types, that is probability versus non-probability. One of the things what we most commonly practice is the probability sampling, where we can simply pick up randomly 1% from the study population, or you can classify them, like for example based on the age, like let us say is a 10 year children, adults, geriatric patient, and you take 10 randomly from those patients. That becomes stratified random sampling or cluster sampling, which usually we practice in community medicine studies. Likewise, non-probability sampling is convenient sampling, that is as and when you feel like you just pick up the patient, and also snowball sampling, especially in case of rare diseases. So next the question is how many? So sample size is the one which helps you to determine how many patients to be included. So when you calculate a sample size as a researcher, you should know what are the requirements, what are the minimum requirements you should take to the statistician for a sample size calculation. So first thing is you should have a clear-cut hypothesis of your study, whether you are trying to prove drug A is better than drug B, or you are trying to prove null hypothesis, that is drug A is not better than drug B. And second thing, whether what type of study, whether it's a parallel group study or crossover study, and also you should have a clear-cut idea of what is your primary objective and primary outcome measure. Certain other assumptions what you make is the effect size, that is what is the probable difference in the primary outcome measures in between the two groups you are expecting or anticipating. Let us say you are trying to assess the assessment between the two groups, drug A and drug B. You assume what is the minimum duration of analysis difference that has to be existing between the two groups to say drug A is better than drug B. So that is the effect size. And next, variance, and then two errors, that is the alpha error and beta error, which represents the statistics, which are mainly considered for statistical perspectives. Then we have the inclusion and exclusion criteria. There has to be a clear-cut decision as to whom to include. And once you include them, certain patients can have some confounding factors. For example, you are doing a study on blood pressure. Hypertensive and hypotensive can affect your study. So you have to remove them in the study. So you can exclude them. Likewise, some of them who don't meet the matching criteria can also be excluded. But one thing what we have to understand is exclusion of subjects is only from those who are included. For example, if your inclusion states that you are including ASA grade 1 and 2 patients, it means that you cannot exclude 3 and 4 because they were never included in the study. Only in ASA grade 1 2, if there is any other problems which are there, which is going to influence your result, only then we are going to remove. But if you are once you included ASA grade 1 and 2, you cannot say that you exclude grade 3 and 4. Next comes the study methods proper. So once we talk about methods, once you start recruiting the patients, you ensure that they have to be equally divided between the groups. The best method is randomization so that it avoids the impact of selection bias, which can be done usually in the form of a computer generated equations or block randomization. Again, I am just giving a bird's eye view. I request you to please go through it because all these things I know it is an alien term for many of you. I just want you to understand that these are the things which needs to be followed, but it itself is a big topic for you. So then we have something called blinding, where we ensure that the person receiving the treatment also as well as the person giving the treatment, particular intervention, is unaware of what he is giving to the patient. For example, if you are giving spinal anesthesia, trying to compare two different drugs, you ensure that they are loaded in the same type of syringe, same type of color coded labels, so that the person who is injecting will not know whether he is giving drug A or drug B. So this is known as blinding. And also the patient will also be unaware of what drug he is receiving. So it's always better to blind as many as possible patients, assessors, the primary investigators, etc. So that there is very less chance of assessment bias coming in. Or else what will happen is the person who, once he knows that he is giving drug A and drug B, and if he wants to prove drug A is better than drug B, invariably he will try to modify the results in such a way. Next is allocation consignment. See, what will happen is once we do a randomization, we will say, okay, let us say patient number 1 will go to group A, patient number 2, 3, 4 will go to group B, again patient number 5 will come to group A. So that way, we classify them into two groups, that is known as randomization. But still, the person who is going to intervene can still know that to which group he can belong to because he is already having the sequence in hand. So how to avoid that? So the best way is, what you do is, you write the allocation sequence. Let us say patient number 1, 2, 3, 4, you mentioned in a opaque C cover as 1, 2, 3, 4, you serially number the opaque covers, and then in that you put randomization sequence of each patient. Let us say cover number 1 will contain group A, cover number 2 will contain group B, 3 will contain group B, 4 will contain group B, and 5 will contain group A. So that these covers are open at the time of intervention. That is, once they are going to, let us say they are giving spinal, just before giving spinal they will open and see whether he belongs to group A or group B, and then accordingly load the drugs and give. So that there is no question of changing the decision at that point of time. Then comes the assessment tools. That is, whatever you are using as a study performer. So it should clearly contain, you should clearly mention what assessment tools you are. For example, if you are doing a questionnaire based study, the questionnaire has to be, before conducting the study, it should be prepared and it should be validated. It should be, you should confirm that the questionnaire is properly, easily understood by all of them by validating, by sending it to experts, etc. And also, you should also clearly mention what kind of scoring systems, or for example, for pain you are using VAS score, for POM scale you are using some other score, for sedation you are using Ramsden sedation scale. So all those things have to be priorly defined and mentioned beforehand, before you start the study, and it should be validated as far as possible. And bias and confounders, as I told, sometimes, for example, suppose you are doing a study on analgesia, somebody is already on NSAIDs preoperatively, obviously it can influence the study outcome, isn't it? So such patients have to be either ensured that they are distributed evenly in both the groups, or such patients should be excluded beforehand. So that is what is known as bias and confounders, and that's how you take care of them. Then once you have completed the study, then comes the role of statistical approach. Basically, once you collect all the data, it has to be filled in the Excel chart and it has to be submitted to the statistician. The results can be explained in two ways. One is descriptive statistics, where you concise the entire master chart into few set of numbers, which can be described in the form of numbers, percentages, mean, median, etc. So that is known as descriptive statistics, how you describe the data. And once you apply statistical tests to them, belong to qualitative or categorical data. So this knowledge is important. I like the postgraduates to take this particular picture so that it will help you to understand, because this is helpful for you to describe about statistics. The next thing is, once you understand what are the different types of variables, now you have to apply statistical tests. So before that, there is something what we need to understand. That is, the data either can be distributed in a huge way or it can be concentrated in one area. So this is known as data distribution. So what we call them is, most of the time we call them as normally distributed or non-normally distributed. I think this has been dealt with you in your community medicine classes, where we discuss about Gaussian curve. With the data distribution respects Gaussian curve, we call them as normally distributed, and otherwise we call them as normal. Now, all that I want you to understand is that this particular knowledge is important, because this is the one which tells you how you describe the data, number one. And second thing, what kind of statistical test you apply will depend upon whether the data is distributed normally or non-normally. So if you see, if you are using any qualitative parameters, with this table you can understand that only chi-square test and Fisher-Exact test are enough for your qualitative. For example, quantitative data. For example, if you are comparing ASA grade 1, grade 2, gender distribution, you are comparing let us say number of patients between the two groups. All those things can be compared by using these tests. On the other hand, quantitative variables such as VAS score, duration of analgesia, age, gender, BMI, all those things are compared using these kind of tests. Okay, so I just want you to take a picture of this test also. So if there are two groups, you can go for student p-test. If there are more than two groups, you go for one-way ANOVA or repeated measures ANOVA. And again, if they are not normally distributed, you go for non-linear test or Kruskal-Wallis test, depending upon whether there are two or more than two groups. So results form the important component of the dissertation, and there should be clear cut. You cannot introduce new subject when you write the result, which is not described in the methodology. There has to be a clear cut plan for representation of each parameter, and you should appropriately use tables and figures And usually it is described under 5 things, that is population data. First you talk about demographics, and then data distribution analysis, and then what is your primary outcome, what is your primary outcome, and how the secondary outcomes are fared, and then any additional observations such as rare adverse effects, side effects, etc. So this is how the table is represented, which has a title, and it has got both dependent and independent variables being represented in the table. One thing I need to stress upon is, always in table the title should come at the top, whereas in figure the title will come at the bottom. So this is a figure. So as I told, it will show there is the title is at the bottom, and it is the advantage of figure is that it is easily readable and visually balanced, and also there are various, you should clearly mention the axis on both the title, on both x-axis and y-axis, what it represents clearly, so that it is better understood. And also there should be a legend. If you see, this helps us to identify which group the study belongs to, and then this is something error bars. If it is mentioned, it adds more importance to your figures. Avoid duplication of data and analytical outputs. Once again, whatever mentioned in the textbook, don't go on repeating that. And then never forget to cite the table or graph in the result section, and never mention the p-value just as less than 0.5 or more than 0.5. As far as possible, try to mention the actual values. Discussion is the process of defending the work by staging a constructive debate. You will just discuss. So it all starts with your primary outcome measures, findings. You can just mention, okay, in the present study, we observed that group A had longer duration of analysis, etc. when compared to group D. That's how you start the discussion, and later go on describing why for all those things, using a proper scientific knowledge based on, for example, the duration of action or the mechanism of action or the concentration of drug. And then you should also explain what is the rationale behind your dosage selection and your technique selection, etc. in discussion. Don't describe in the methods or method section or result section. All those things should be described in the discussion section. And also always start with the inference based on key observations, and then also mention the scientific rationale behind the study. Compare your study observations with other studies, whatever you have found, and see whether they concur or they differ. If they differ, try to find out scientifically what are the reasons why it is different. Sometimes it might be the technique, sometimes it might be the dose, sometimes it might be the timing, so many things. So you try to find out what is the thing, and also mention the strengths and limitations of your study. And also the future scope, like based on your study, what future studies can be done based on your observations. Conclusion should be very precise, and it should be just as a take-home message, and it should be predominantly based on the primary aim only, primary aim and objective. Don't try to introduce new things in the conclusion. And the work carried out should be summarized, and the research question should be succinctly highlighted in your conclusion. Many thesis dissertation, they also require you to present a summary where you can write the entire methodology, results and conclusion into a single one-page summary also. So this is the workflow of a dissertation. So you should have the introduction name, relevant anatomy, physiology and description of device and pharmacology, whatever you are using in your study, and also the review of literature pertaining to that particular study. Once this forms the part 1, and then material methods, observations and results and discussion forms the part 2. Which also includes limitations of study and conclusions. And then in addition, we have bibliography, pro forma and master chart as a part of dissertation, which you need to attach to the dissertation. Finally, some of the necessary certificates from the guide institute are a requirement for the dissertation as per the university guidelines. Last but not the least, never forget to acknowledge all those people who supported your dissertation. This is one of the things which is less looked upon, but please respect those who supported your dissertation. So while writing, ensure that the title is complete and it conveys the primary objective, and the problem statement is well represented in the introduction section, and also in the methods, all these things are followed properly. Aims and objectives, type of research, methodology, including all the things whatever I described so far has to be covered in the method section. In research section, there has to be orderly narration, and tables and figures should be properly cited and well represented. In the discussion section, scientific rationale probable scientific explanation, everything has to be clearly mentioned. Conclusion should always be preferably be based on the primary outcome. References, please make a point to ensure that they are properly followed as per the Vancouver style. That is what the requirement of our most of the Indian universities. As far as possible, try to ensure journals are cited as per the requirement and textbooks are cited as per the requirement. Both of them have got a different style of citation. So keep in mind, and also ensure that citation of internal resources are done in an appropriate way. Proforma and master chart should be complete, clear and devoid of ambiguous statements. Finally, when you acknowledge the head of the institute, mentor, co-guide, faculty who help, support staff including. This is one of the things what many of them do miss. That is, don't forget to thank your nursing and technician group because they would have contributed a lot to conduct your thesis, and your physically, statistician and also technical help people should be thanked, and patient, finally your family. Thanks for your patience here.
Thank you, sir. You have enriched into the statistics topic.
Now I request the chairpersons to honor Dr. Sudheesh sir. Stay inside. We have 2 more sessions. The next topic will be on transport of oxygen and carbon dioxide by Dr. Kaushik sir. To chair the session, may I